to walk in this door talking about your drug use.
Okay.
You may come in this door because you want acupuncture.
Okay.
I don't know what your drug history is. I don't know if you are the loved one of someone who is doing the drugs, right? Not my business. All I know is that you are here because you see value in this space and what you think it can contribute to either your journey as an individual with a history of use or in the way that you are loving somebody.
All right. Well, first of all, I'm so happy to be here with Dr. Pullen, or affectionately known as Dr. P. We met years ago when we were starting our careers in advertising at BBDO. And to be able to reconnect with you, I'm super thrilled. And I'm excited about the Zebra Strategies posse, so to speak, to hear about the work that you do, and more importantly about who you are as a person. And for Zebra and for the work we do, it's important that we lift people up and that we help people who need it, and we overstand for people. And I think you're a perfect example of that with what you're doing. So I want to spend some time talking to you about what you do, about who you are, and also about some of the needs that you have in this community called Harlem. Does that sound okay?
That sounds great.
Great. So Dr. Pullen is the executive director of Pillars, and I want you to tell us a little bit about what is the objective and mission of the organization.
I love that question.
Okay.
You know, Pillars is really not my house.
Okay.
It is God's house and it's the people's house.
Okay.
And they are who built the mission, and I, presented a vision and they tweaked it along the way.
Right.
What that looks like is this holistic 360 approach to support people and their families and their integration back into the community and society as a whole.
Okay.
And so we have processes and programs and services in all of those 4 areas. And Pillars is just love.
Okay, I like that. It's just love.
It's just love.
Okay. And I want to know if you can talk to me a little bit about how your personal experience, your personal lived experience has shaped how you've created Pillars and how you continue to create Pillars.
What I know is that I'm no different from anybody who walks in the doors here.
Okay.
And it is really my own journey with addiction.
Okay.
And my journey in recovery. So interestingly enough, my recovery month is in April, and we're sitting here in April. I do call it my birthday.
Okay.
And I'm already getting emotional because I am no different than anybody else who comes through these doors. I know and I believe that everybody who comes here is supposed to be here, and they're either going to learn or teach somebody else in these doors.
Okay.
And so my journey is, and the privilege within my journey is how we got to the brick and mortar of what the Pillars is.
Okay.
I always understand that because I had really great health insurance, I was able to receive what I received when I went into treatment, when I went into detox, when I began my recovery journey. And I didn't want the lack of finances to be a barrier to receiving some of the things that I was privy to.
Okay.
And so that's how it all came about here inside of these doors.
Wow. So it was about acknowledging the privilege that you had and trying to give that privilege to others.
Absolutely.
Powerful. Yeah. What are the main pillars of this organization?
So there are 4 tenets of the Pillars.
Okay.
And so the first thing we support is people's love of themselves. And that is done through yoga, meditation, acupuncture, Reiki, because the individual is the direct beneficiary of that.
Sure.
And then we support the family. And so the way that they do that are parenting skills enhancement classes. We have bereavement groups that really support that journey, and a community closet that has men's, women's, and children's clothing in it. The third piece, so it's kind of like this target, if you will, and you're at the center of that target, and then your family, the community is that third ring. And so in the community support, we do things like naloxone trainings and distribution. We disseminate information in the form of door hangers, and we've put 16,000 of those on individual apartment doors in 9 NYCHA developments. And then the last part is the societal piece and how we support people's integration back into society, and that's the workforce development.
Okay.
So like in 3 years, we trained 450 people to receive either OSHA, scaffolding, security guard, home health aid, teacher's aid, certifications.
Wow.
And so that's like the 4 parts of the pillars and how people use the services here to journey.
Wow. Wow. How has the trajectory of the work at Pillars changed over the past few years, if it has?
Yeah, it definitely changes with grants. For example, when we had the workforce development initiatives, we did that in 3 years because we had a federal grant that allowed us to do that.
Got it.
So now that that grant was exhausted and we don't have that grant, we're not doing that kind of work.
Right.
But then we got in another grant that allows us to do more prevention of the onset of use for teens and youth. So that's another division that we have that now we're getting a lot of attention and funding around. So it is a living, breathing thing, this organization. And with the flow of money, it just allows us to do what the community wants and needs in different ways.
Okay. And speaking about what the community wants and needs, what kind of interactions can people expect to come to Pillars? What can they see?
Yeah, love from the front door all the way back to the yoga room.
Okay.
They can.
Is that unusual in this community?
I don't know if that's unusual in this community, but what I do know is that the way that we deliver that is unique because this is not a state agency, although we have money from the state. This is a space that the people are the ones who are running it. And so there is a very different give and take of energy and information in this space than in something like, I don't know, like DMV, if you will, right?
Okay.
So that love that you get in here, it may not come from me.
Right.
It may come from somebody else that's sitting on the couch.
Gotcha.
It may come from somebody else that's, in the conference room.
Gotcha.
So yeah, it could come from the person that's giving Reiki or Tai Chi or acupuncture. You just don't know where it's going to come from.
Okay.
And they're, the expectations are that you're going to get it. You just don't know from whom. Yeah.
Okay. So with those expectations, are there other things that the community members are seeking when they come to Pillars?
Yeah. The biggest gap is physical capital, housing.
Okay.
Housing.
Okay.
There are so many people that are either unhoused, living in shelters, street homeless, living on a couch in a friend's house. And so housing is probably the biggest ask of us to support people either in getting a voucher or navigating the system. How can they apply for services that they may not know how to navigate those systems on their own. So they definitely ask us to do that, and that's probably one of the biggest asks.
It's interesting because one aspect of Zebra's ethos is acknowledging that what we call a web of inequity, right? And it's this meaning that people have more going on in their lives than just one aspect that we're discussing, right? And I'm curious to know, how does Pillar address that in the work that you do?
Something that we do really well is not only acknowledging that there's this intersection of inequity around race and geography and poverty and substance use. We not only acknowledge it, but we talk about it, and then we talk about strategies to address it. And I think that that's something very unique to who we are and what we do and how we do it, because being a recipient of certain funding, you really have some parameters that
Yes.
you have to live around
Right.
within.
Yes.
And I am very comfortable being outside of the box.
Okay.
So I'm very comfortable when I have the privilege of being in spaces and places talking about the inequities and then talking about what the people have told me that they need and how we can address those intersectional inequities, health inequities, housing inequities, social inequities. Like, we need to understand that this conflation of race and poverty and geography is definitely impacting people and their use, their health, their mental health, psychological health, physical capital, emotional capital, political capital. And so we need to talk about it and not call it social determinants of health. Right? It's political. So we need to call it what it is.
Got it.
And talk about it.
Okay. Talk about it more.
And talk about it.
Okay. Do you think who should talk about it?
I think that anybody who has a seat at a table needs to talk about it. Because not all of us have seats at the table. And so if I have the privilege of a seat at this table internally, inside of the Pillars, and the people are telling me something, one, I have to believe them that what they are experiencing is true. And then when I am sitting at other tables that they do not have a seat, I need to go back and tell that information to the people who have the power to do something about it. Recently, I saw a very respected researcher promoting a conference and announcing the 5 keynote speakers, and every one of them was white. And so I chimed in and said, very well respected individuals. We have a lot that we can learn from them. However, if Black people and people of color are dying at the highest numbers and the greatest rates of increase, why don't we have Black people, researchers, activists, advocates on this panel and keynotes? So things like the Black Harm Reduction Network, Black Faces and Voices. I think that they do amazing work at going, we don't need the validation of the white organizations for us to do the work. We've been doing the work. We've been doing the work effectively. So now we're just going to promote ourselves in being qualified.
Got it. I mean, one of the things we practice at Zebra is racial concordance. And so it's the idea that, when we think about there are better health outcomes when the practitioner matches the race and ethnicity of the healthcare practitioner. So in our minds, we think that the researcher should match the ethnicity and the background of the person being researched. And believe it or not, that's uncommon.
Yeah.
And I think that we miss an opportunity to get those nuances that can only be touched and reached when there's some commonality. So it's interesting that you seem to be seeing the same thing in your space too.
Yeah, absolutely. And there is language that is unspoken.
Exactly. That's exactly it.
Like, we can look at one another and we know exactly what is being said.
Exactly. And the time that it would take to explain it sometimes, it just wouldn't come across the same.
No.
So I hope that people start to embrace that more and understand, and also too, I think this appropriateness. Like, I think there's an appropriateness and a sacredness that comes between people of color that are speaking to each other about things that people of color speak to each other around, that cannot be compromised, right? And also, I think in this inflection point in our country, nobody wants to be at a place where they're teaching, right?
It's exhausting.
It's exhausting. The stuff you do is so awesome. And the last time we spoke, I was like, I have to come back here. And I was so excited. Addiction is difficult. It's a difficult topic and it's complicated and there's many issues that need to be addressed. How does Pillars encourage and protect the dignity, esteem, and integrity of the individual that it serves? How do you all do that?
Yeah, I think that we do that from the front door all the way through. Things like, there's no intake process.
Okay.
You don't have to walk in this door talking about your drug use.
Okay.
You may come in this door because you want acupuncture.
Okay.
I don't know what your drug history is. I don't know if you are the loved one of someone who is doing the drugs, right? Not my business. All I know is that you are here because you see value in this space and what you think it can contribute to either your journey as an individual with a history of use, or in the way that you are loving somebody that is using, that is being disruptive to the family homeostasis, right?
Right.
The family flow. So yeah, we just support the dignity and respect from front door all the way through. It can be really difficult and off-putting to lead with talking about your drug use, right? Because we are multifaceted people. Maybe I am a woman with a history of use, but I'm really here because I want to learn how to get my relationship back with my children. And I may not want to talk about my use and how that contributed to the breakdown of my relationship with my children. I just want to learn how to take a deep breath and stop beating myself up.
You know, it's so interesting that you said that because I have this belief, and I've always felt this as a researcher, that I only want you to give me the information you want me to, because there's something about permission and use that's important to me. But we're doing things where we're getting information about people without their permission.
And misusing it.
And misusing it on sometimes. Yes, definitely. So for me, I've always felt, you know what, tell me what you want me to know. And you know what I find when you do that, people end up telling you twice what you'd expect.
The level of trust that is opened up because of the way that we honor people. So I'll give you a quick example. There was an individual who just started coming in, and that individual would be the first one that I would see in the morning and the last one that walked me out at night. And most of the time was spent in the computer lab.
Okay.
And, you know, we would just touch one another in conversation little by little. And the individual said to me, but when I'm here, I'm not smoking crack. And I'm like, oh, light bulb moment.
Right.
This is harm reduction for you. We never talked about his drug use or, you know, what drug they were using. So as time went on, that individual started taking different suggestions and then started doing acupuncture, started doing full body acupuncture, and then had this period of recovery as they defined it as abstinence, right? Because it's never up to me to decide what recovery is for anybody. And interestingly enough, the individual had about a year without use. And we extended an offer to this person, and in that offer, the individual started taking on more and more responsibility in here and guiding other people on their journeys. I recently had a conversation with this person, and they said, "You don't know this, but you're on my health proxy." If anything ever happens to me, I want you to be the one to converse with the doctors. And I'm like, you do know I'm not that kind of doctor, right? But it's that level of trust without bridging somebody's confidentiality or forcing them to divulge things. It was just easy and organic.
You didn't say, I want you to be the person that you didn't say to them, I want you to trust me.
And this took a year.
And it was organic. It was intrinsic.
So organic.
Wow. I'm with you all the way. I'm with you all the way on that. I just totally believe in that. How do you feel how do you tailor your services to best meet the diverse needs of the communities? Because you talk about the loved ones, the caregivers, right? And I mean, there's also the harm reduction workers. How do you tailor all of that?
Yeah. Thank goodness it's not me who tailors it, right? The community, right? And so, for example, through one of our partnerships with the community hospital, we learned that an increasing number of babies who were tested were testing positive for THC in their systems. And the next sentence was, well, what should we do about this? I'm like, I'm no doctor.
I know.
But I was honored. Right? That the hospital came and asked me because they felt like I had a finger on the pulse in the community. And then using that marketing background, right? That advertising background, I'm like, I have some ideas. It does come in handy, right? So I'm grateful.
Yes, me too.
And then we came up with the door hanger campaign. And it was the information saying that a pregnant woman never smokes alone.
Right.
And it was the medical information of the impact to the fetal brain development.
Okay.
And then no judgment on the other side. It was, and come take a yoga class.
Right.
Right? Come and de-stress in the Pillars.
Got it.
So it's that kind of creativity based on the information that we're getting from the community
Right.
that helps us design what the community needs at the time. You know, whether we're talking about K2 Spice, because this is ground zero in 2015, we'll do that, right? And so as time flows, so do the services ebb and flow, and we just try and keep up with the statistics and whatever the community is telling us that they want based on what they're experiencing at the time.
Got it. Got it. What is Pillars' role and impact on racialized drug enforcement policies?
Harlem, the community, was definitely negatively impacted by racialized drug enforcement policies. And we saw that in the rate of mass incarceration of Black men.
Right.
We saw that in the separation of Black babies from their mothers.
Right.
And so we at the Pillars make sure that we talk about the fact that racialized drug enforcement policies exist, the impact on the individual, the impact on the family, the impact on the community. When things like the RICO Act are used to suck 125 men out of the community on one day from two NYCHA developments that are across the street from each other, right? There are grave impacts to that we are not seeing in white communities. And so without us talking about the crack to powder cocaine 100-to-1 disparity law, nobody is thinking about how powder cocaine that was, used on Wall Street compared to crack cocaine that was perceived as a drug that was predominantly used in urban neighborhoods. It took 500 grams of powder to, 5 grams of crack to trigger the same mandatory prison sentence. So we need to talk about that. And so the Pillars, probably not so much the Pillars, but I talk about that. I talk about that in Pittsburgh. I talk about that in Portland. I talk about that in DC, because it's important to understand the impact on people of color, the laws that were designed in DC, in Albany, that do that. We need to talk about that.
Absolutely, absolutely. I'm curious to know, why is this organization's work critical to public health or the pharmaceutical industry, in your opinion?
This organization, through me, is a trusted voice of people of color. And so having the ability to do a racial justice and healthcare initiative for a major hospital in New York every month is important to helping healthcare providers understand the impact to people when Medicaid is not reimbursing at the same rate as private pay insurance, and how that is impacting the healthcare of the people in communities that are steeped in poverty. We need to talk about that. So I get a chance to do that. I get a chance to be an activist and an advocate more than a researcher. But I think the letters behind my name help people to hear me differently.
Okay.
So I'm still saying the same stuff that I was saying when I didn't have the letters, but now it's being heard differently, and I'm being invited to different places and spaces to say it, and it's being absorbed in ways that it wasn't absorbed before.
Okay. And then in terms of the pharmaceutical industry, is it the same idea of that trusted voice?
I don't want to completely vilify the pharmaceutical industry, right? Because medications are important.
They are.
Right? So I think that it's important to level set at that and to say that medications are important. There were some abuses
Right.
with medications and to loopholes that, existed that have since been plugged.
Right.
And then we're still seeing the consequences of that.
Sure.
And so I think that it's still important for medications like buprenorphine, like methadone, like naltrexone and Vivitrol. Like there are important medications to moving forward this field and this industry and the health and wellness of people. I still think that we have a lot of growth areas when we look at the rate of buprenorphine and how and where that's distributed compared to how and where methadone is done. How do we give medications that support harm reduction and support a person's journey equitably? It's not really done equitably yet. How do we give take-home doses so that people who have jobs are not standing on the methadone line at 6 a.m. just to get their dose before they go to work, right? So how do we begin to integrate dignity and respect in that? And I think that that's like still growth that we have to do as a field.
Interesting. Dignity and respect in how people receive medication.
Absolutely.
Yep.
So it's not just, people in addiction, it's people with that intersection of poverty, geography, and addiction that are receiving care differently than people on Park Avenue.
I want you to elaborate on your mixed method recovery capital assessment tool.
Yeah.
And how you implement it to address harm reduction amongst the communities that you serve.
Yeah, so I'm just a creative.
Right.
I can't draw, I can't play the piano.
Me too.
I can dance, but I digress, right? So the Meerkat was really an extension of my research, of my dissertation, of my research.
Okay.
And I started to look at tools that were doing a really good job of assessing for recovery capital. So a lot of my work is rooted in recovery capital. I'm just a recovery capital fan. And so what I saw as gaps in the other tools, I plugged the holes.
Okay.
And so the way that I did that is I didn't just ask on a 5-point Likert scale, on a scale of 1 to 5, how likely are you to say that your housing is stable?
Okay.
Because if you say 5, and then what? What do I know? What did I learn?
Right.
Not much.
No.
But if I say on a scale of 1 to 5, how likely would you say is your housing, 5 being very stable, right? And you say 3, and I say, interesting, tell me more about that. Tell me why you answered that way. And then you begin to say, well, sometimes I, am able to get a hotel room, but sometimes I am on
the house.
Then that tells me a lot.
Definitely.
And then I can begin to use that information to put together, in partnership with you, a recovery plan to stabilize that housing.
Okay.
Or any of the other tenets of recovery capital.
Got it. And what kind of successes have you seen with this framework?
The framework was around long before me, so I cannot take credit for the framework, but what I am hearing from people who are using it is that it helps to standardize the process so that person peer A and peer B in 2 separate agencies are asking the same questions.
Okay.
And therefore we can compare, and you can revisit this tool so that you can see from interview 1 to interview 2, I can see how this person's housing stability
has changed.
Has changed.
Got it. Thank you. You know, it's interesting because at Zebra, we believe in trauma-enforced care, right? And it's a major asset in capturing experiences with care, Why are tools such as the MRCA test,
The meerkat.
Meerkat, also, why are tools such as Meerkat necessary in harm reduction work? How do they promote trauma-based care?
Because it's not just tell me about your drug use. It's tell me about your relationship with your family, right? Tell me about um, your physical capital, right? Are you employed? Do you feel like you are able to be employed?
Yeah.
So it is so driven by the person, where you go with the information. It is not this, militant, prescriptive, go down the line, and you get a chance to lean in and go, I heard you say that you hadn't spoken with your daughter in a year. Is that something that you want to change? How would you like to see that change?
I so love to hear this because it's interesting when we do professional research, so to speak. I'm always, encouraging our colleagues to talk about temperature check, to check in with people. And because sometimes we're so focused on, getting information about this app or this particular drug or this disease state, and we're not stopping to just check in with people. How you doing? And a lot of people need that. They just need that check-in moment, that kind of like just kind of be a little less focused on what am I getting out of this research, and kind of leaning into what is this person sharing with me, and how can I listen to them in a different way. And so I really like to hear that idea that you can just take time to listen to folks.
And for me, it's a privilege.
Yes, it is.
An honor and a privilege. And then I found that people are like, oh, I told you things that I've never told anybody.
Right. I agree.
And I feel lighter walking out this door.
Yeah. And it is a privilege. It is. One of our central tenets at Zebra is this idea of cultural humility. And as we aim to create a safe space, right, where marginalized individuals feel seen and heard, right? How does the work at Pillars approach cultural humility, this idea of cultural humility?
Yeah, I think that we are very fortunate that in here, we don't really have to talk about cultural humility because it is people of color that are in here loving on people of color. Okay. Every now and again, and so here's an example. Mr. Wong teaches Tai Chi, right? And he's like, you are my sister.
Okay, got you.
And so the cultural humility piece is we are meeting each other in this umbrella and in this space, so we know what the culture is in here. Right. It is, respect and honor and grace for everybody regardless. Okay. So it's not even like there are racial nuances under this roof. Right. But it is when we go outside of this protected bubble that we have built that we really have to drill down and talk about cultural humility. Yes. And so I feel honored that I get a reprieve from it while I'm in here every day. Yeah. And people get a reprieve from it while we're in here. We're just like, we're home. Welcome home. Thank you. Love you. People conspiring to keep me healthy, keep me fed, keep me clothed. And we're just all journeying together. But it's outside those doors where the cultural humility piece, you are facing it as soon as you put your foot on the pavement. And so what about if I want to be better at this? What about when I'm one of those people outside of Pillars? How do I do that? How do I get to a place where I maybe practice cultural humility? What are some things I can do if I'm a general market researcher and I think I'm doing it, but maybe I could do more? Yeah. I think one of the most important things that people can do is listen with the intention of learning, not responding. Believe the information that you are hearing, even though it may be counterintuitive to your own experiences, don't make it the responsibility of people of color to teach you about people of color, because there are enough resources available at the fingertips of general market researchers to do a lot of that heavy lifting without the emotional taxation on people of color to teach that.
Got it.
There are enough books. There are enough workshops and worksheets, and so don't put that burden on people of color to teach you. And so I think that understanding that racism is real and people of color face it, live it, eat it, breathe it every day is a reconciliation that general market people really have to get to. Stop being swept up in the news and the media that is being fed to you that something is bad and wrong without knowing what it is yourself because you haven't done the work. So, that to me is how you get to cultural humility.
Got you. Okay. How does Pillars encourage empathy or aim to protect the individuals that it serves?
I'm just grateful we don't have to, because it is just in every thread and fabric and chip of paint and chalk on the wall. It is what Pillars is.
Right.
So we don't have to emphasize empathy.
Right.
It's just who we are.
Okay. What are some of the risks and challenges in the work that Pillars does, and how do you tackle the challenges?
I think the biggest challenge is financial sustainability.
Yeah.
So when every dollar is dependent on me writing grants or meeting with, people who can open up their purse strings and say, I believe in the mission and the vision, so let me contribute to that. So it's the financial piece, right? Because we do amazing work. We are the highest performing recovery center of all downstate New York.
Wow. And
we have the smallest budgets compared to all of the other recovery centers downstate New York. And so it's that financial instability that is the greatest challenge. It's never the work, because we do whatever the community tells us to do.
Right.
And that's why we're always on the mark. But it's the finances that's the greatest challenge.
Okay. What are the future aspirations for Pillars and the work that you do as a researcher? What are some of the aspirations that you have?
Ooh, aspirations.
Yes, what are the aspirations? Let's dream big.
As a researcher, my goal is to really be that subject matter expert on recovery capital, harm reduction, but specific to people of color, and to be a voice for the people that I've had the privilege of interviewing and speaking with. I don't think of them as subjects, because that to me in the language in itself is just wrong.
Do people do that? They think
absolutely, right? The subjects in my study. I am not studying people. I am.
What do we call them then? If they're not respondents and participants, what do we call them?
I don't mind participants. I don't like subjects. I hate the word patients. Right? People use that often. This hierarchical, I'm going to fix you medical model. I don't subscribe to that. And when I speak to med students, I'm like, yeah, we need to forget that word, right? Because we're the experts in our own bodies, right?
Right. So if we're not patients, what are we?
So we are clients. We are, right? We are
yes, we are
members. We are subject matter experts in our own health, in our own bodies. So understanding that we are the experts, people are the experts. So I just have the privilege of exploring your experiences, asking the question to elicit your perceptions and experiences. So one, I want to, as a researcher, be seen as that person that we really should be asking to gather information from other people of color in this field. So I want to be that go-to person. As far as this organization is concerned, I want to support the health and wellness of teens and youth in Harlem.
Okay.
So we do that a little bit on the Safe in Harlem side, but there are some real concrete ways that I want to see that done in the next 2 years.
And what might those ways be?
Applying for and receiving a license to support the mental health and wellness of young people of color. That means also utilizing culturally responsive, evidence-based practices relative to their substance use, their recovery, their family unification and support for the family unit, just really in culturally responsive ways. I don't want to take an evidence-based program of practice and drop it down into a community that is full of people of color going, this is going to work for you. No. Let us understand what the unique challenges are of people of color, and then let's make sure that we are connecting them to evidence-based programs and practices that are going to support them. So I want to make sure we do that for teens and youth.
Okay. So for the last question, I want to set the stage, and it goes back to our lunch that we had, which was really lovely. And it's interesting because again, at Zebra Strategies, we don't just want to get information from people, but it's how we get that information is important, right? We care about the experience that people have in terms of how we get the information from them. So it's not about we give you money, you give us your thoughts and opinions. It's kind of more than that, right? And I think that's kind of aligned with your methodology, especially the language that you use, right? So I'm thinking about when we had a great lunch and we chatted and we left. And then as we left, we were walking and we passed by some folks that you thought might be helpful for your research project. And these were folks that were people who use drugs and people who might be unhoused. And they were older folks, right?
You're going to make me cry.
Uh-oh. She's going to start crying. It's okay. And you said, those are my people, they'd be great for my research project, but I don't even have any flyers with me. I said, well, let's go and talk to them. And I said, if you've got a business card, we can, and we went and we chatted with them. Well, you chatted. I was just your wing lady.
You were a great wing lady, though.
Thank you. Thank you for that. And so I was the wing lady handing out business cards and chatting with them as best I could and encouraging one of the gentlemen to come to talk to you about housing. And we were there for about 3 to 4 minutes. And I would say that some people in different circumstances would look at those folks and be frightened or afraid to walk down the street with them. But after we finished our conversation, or you finished your conversation, you said it was an honor to have this moment to speak with you. And I was so touched by that because that's not language that we hear when we talk to people who are living those kinds of experiences. Honor, the word honor. And I saw a change in their carriage when you said it was an honor to speak to them. They stood up, they felt different about themselves.
Yeah.
And I was really touched by that because what I thought about is that, you know what? How many times do people say it is an honor to speak to you? I can't count on my hands the amount of times people have said it is an honor to speak to you. And so when we're thinking about people and their experiences, and we think about empathy and we think about this stuff, I hear the language that you talk about, honor and privilege. So I kind of wanted you to talk to me a little bit about that idea, right? When you're talking about this idea of honor.
Yeah. So I think it starts with how I see myself. And I see myself as a servant. And so I don't see myself as this researcher who's, no. I also see myself as a baby of Harlem. I'm Harlem's baby. I was born and raised here. I was born and raised in the time of the heroin epidemic of the 70s. And I know how that devastated this community.
Mm-hmm.
But I also remember as a little girl walking south on 7th Avenue past the Teresa Hotel, which is
my office, right?
which is where your office is. And I was a little girl. My mother was 5'2". I'm 5'9", barefoot, right?
Okay.
And this gentleman said to her, "Hi, how are you?"
Mm-hmm.
And she goes, "I'm fine, thank you. How are you?"
Mm-hmm.
Now, even at this young age, because I'm looking up at my mother. My
Mhm.
mother was 5'2". I'm looking up at her. I was
Mhm.
little. I knew that this gentleman was a drug user. I could tell. I knew that. I could tell by the swelling in his hands
Mm-hmm.
from where he was injecting. I didn't have the language
Right, but
then,
you knew.
but I knew.
But you knew.
And I remember I looked up at my mother and I asked her, "Do you know him?"
Mm-hmm.
And she said, "No, but let me explain something to you. Anytime anybody in this community speaks to you, you make sure that you speak back because you never know when that person is going to come and save you one day."
Mm-hmm.
And so I grew up in this community not being afraid of my people.
Mm-hmm. Mm-hmm. Mm-hmm.
I grew up in this community understanding that anybody and everybody might come to my rescue one day.
Mm-hmm.
And so I treat people in that way. And I never thought that one day I was going to be a person who was so gravely impacted by drug use herself.
Mm-hmm. Mm-hmm.
So I'm really glad that I grew up with this respect for anybody and everybody in this community. And so when people allow me into their space, because I could have easily been dismissed by those people that day.
Yes, that's true.
It was a privilege that they invited me in.
Yes, it is.
And so I felt like I needed to acknowledge that.
Mm-hmm. Mm-hmm.
About a month prior to that moment, I was walking down that same street and engaged with these gentlemen
Mm-hmm.
that were in the cut.
Mm-hmm.
And I'm like, "Hey, sorry, if you..." And the guy goes, "Oh my God, it's you." And I said, he said, "You Narcaned me in front of your office."
Wow.
And he said, "You saved my life."
Mm-hmm.
I didn't recognize him. And he said, "Every time I come out of the subway, I want to come by. But I feel a little ashamed. So, but instead, God brought you to me
Wow.
so that I could thank you." And he said, "If anybody can help me, you can help me." And I said, "No." I gave him a hug, man, because
Yeah.
I don't know when the last time he was hugged on
Yeah.
that street.
Yeah. Yeah.
But it was because of the gift that he gave me that day
Mm-hmm.
that I hugged him.
Yeah.
Not because of what he's saying that I gave him. And I said to him, "No, I can't save you. It's you that will do the work,
Mm-hmm.
but I'm here."
Yes. Yes.
So I'm just a vessel,
Mm-hmm.
and that's how I walk these streets. That's how I walk this earth. I'm not special.
Mm-hmm.
I'm just a vessel.
What I think of as a researcher and as a person that is trusted in this community, this whole idea of honor, I'm kind of wrestling with the idea of empathy as a concept. I think we need more than that. I think we need honor. I think we need honor. I think we need dignity. We need esteem. We need things that are stronger than that. And so to see you honor folks who are not honored was really beautiful. And I also feel that, again, in all of our lives, how many times are we told that it's an honor to speak to you, or it's an honor to be in your presence? And so maybe that's something we have to sort of look towards more, the language.
And integrate that. Yeah.
What do you think?
I like it. Well, it was an honor to speak
It was
to
an
you
honor to
today.
No, it was an honor to speak to you. And I appreciate it. I mean, God, we went through a lot more than I thought we would. Is there anything, so many people are going to see this and be impacted by it. And so many people may want to do things or support or offer is there anything that you want to say that I didn't cover that you wanted to make notice of and mention? I think you definitely have your fundraiser coming up.
We do have a fundraiser
Yes.
coming up. Thank you.
Yes. Yes.
Yeah, we have a fundraiser coming up on September 19th.
Okay.
So I love music.
Okay.
It will be a musical fundraiser.
Okay.
Peter Collins is going to be performing,
Nice.
and it's an opportunity for people to see the work that we do,
right,
and to honor the work that we do.
Okay.
To be able to support us beyond the grants that
Yes.
I sit and I write,
Okay.
and have a great night.
Okay.
We're gonna love on that member that I mentioned.
Yes.
Because it's really them
Okay.
that deserves the honor.
Okay.
I'm just
Just
a
a
vessel. So,
Well, I think that I think it might be a good opportunity for people to start honoring each other, right?
Yeah.
And getting an opportunity to as you say, have these kind of privileged conversations, right? And I do hope in our conversation that we've had today that it encourages a lot of researchers and a lot of folks that are in the space of research and marketing and all those types of things to kind of think about this idea of honoring the folks that we do work for, honoring the organizations and the communities, right? And and understanding what a privilege it is to support these communities and support all of these people. It's a privilege, right?
For me, I think
it's a privilege. I think it's definitely a privilege. It's not about curiosity. It's not about sympathy.
or exploitation.
Or exploitation, right? Or learning. It's a privilege and it's an honor. All right. Beautiful. Thank you.
Thank you.